Can you give us a sense here of, I guess, how long does it take to sort of create or at least find some sort of, treatment of or vaccine for the people who might be exposed to the coronavirus?
Well, thank you very much for the invitation. With respect to your question, it takes months to years to develop effective therapeutics and treatments as well as vaccines. However, in these type of emergency situations, as we've witnessed with Ebola, with Zika, the United States, NIH here, as well as global partners, have been able to roll these out very quickly under initiatives run by WHO, so that actually vaccines, which are being prepared right now for the novel coronavirus, are actually slated to come out in the next 3 or 4 months for clinical trials.
Dr. Ko, thank you for joining us. Can you tell us how you feel that China is handling the outbreak? Are the current measures being taken enough?
Well, so just to give some background, we're in the exponential phase of this outbreak, and the numbers were up to 4,500 cases that have been reported today. These numbers are rapidly rising, and these numbers reflect infections that occurred weeks ago. So these numbers, the actual numbers of people infected, are likely much higher than indicated, and there have been estimates that from mathematical models that there may be up to 100,000 people infected at present. These numbers are alarming, but they likely are they may not likely be true. With respect to what China is doing, it's this is unprecedented. These travel bans of over, with over lockdowns of over 50 million people. We've never witnessed this in history. It's not clear whether this will be effective or this will be too late, or whether there'll be untoward effects in terms of driving people from seeking medical care.
I mean, the map is pretty scary, how quickly and how far and wide this is going. Does this have a breaking point at which this can get out of control?
Well, I think there are two really important questions, and questions that we still are trying to get evidence from, and as the epidemic has revolved. The first one is that how many people moved away from the epicenter of the outbreak in the city of Wuhan, that were infected with the virus. As you know, from the Lunar New Year, over 5 million people left that city. How many of those are infected will be an important question in terms of how this plays out. The second question is, which you alluded in your report before, is that whether people, the Chinese Ministry of Health stated that people can transmit the disease before they become ill. We have some evidence now from the case in Germany that was reported today that may in fact be the case. And if that's the case, that's going to be a large or major challenge to how we're going to combat this outbreak.
Okay, you used a lot of words like challenges and underreporting. If that's the case, why has the WHO declined to declare this an international emergency? And if this does end up being underreported, will declaring it an international emergency change the way that countries are responding to it?
So that answer, I think, is being deliberated at this moment. They did place the outbreak in terms of high alert. It's not a public health emergency of international concern as of yet. That may change dramatically as we see the epidemic evolve, and especially as it's spreading throughout different countries outside of China.